Very warm welcome to the 7th episode of the Inside Implementation webinar series. So this is a webinar series that was started under the Anusthana project, which is an implementation research project being conducted at the Institute of Public Health. This project is supported by the DBT Wellcome Trust India Alliance, and it is a 5-year implementation research project. The main aim of this project is to understand and explain the implementation of tobacco control policies in India. So as part of this, we've been conducting webinars on mainly COTPA implementation, the role of civil society in tobacco control. Today, being the World Head and Neck Cancer Day, we are conducting this episode wherein we bring together a cancer surgeon, a cancer survivor, as well as a state-level official who is involved in tobacco control and cancer control activities. So I would like to do a brief round of introduction, as all of these individuals are eminent personalities in their own fields. So to start with, Dr. Vishal Rao. He is the Chief of the Head and Neck Services at the Surgical Oncology Department at HCG Bangalore. Thank you, Dr. Vishal, for joining us, making the time today. Yeah. So he is also a TEDx speaker and has an innovator who has invented the Om voice prosthesis to help people post-cancer, especially who have lost their voice, to help them speak again. And beyond this, he's also extremely well published. He's also the reviewer on several international and national journals, and is the recipient of several national and international awards. And lastly, he's also a mentor to several of us here at the Institute. So a warm welcome to you, Dr. Vishal.
Thank you.
We also have with us Mrs. Nalini Satyanarayan, who is a cancer survivor, and she was diagnosed with vocal cord cancer in 2010, and she underwent a surgery as well as radiotherapy, and she was treated and is cancer-free. And she's not only been treated but also bounced back to life, and she's an inspiration for many as she joins as a volunteer in several training initiatives by not only Institute of Public Health but several other organizations. She's also part of support groups and counsels cancer patients, help them navigate this crucial phase post-diagnosis, accepting the disease and overcoming it. And we also have with us Mr. Prabhakara Pujari, who is the State Program Manager with the International Union Against Tuberculosis and Lung Disease, or the Union, since 2013. Prabhakara has completed his Master's in Social Work in 2004 and another PG Diploma in Industrial Relations and Personnel Management in 2007. He has a vast experience of over 16 years in the development sector and has overseen programs like the National AIDS Control Program, National Tobacco Control Program. So with this diverse experience and this panel, I'm pleased to have you all here today with us. So to start off with and to set the stage, I'd like to start with Dr. Vishal Rao. So it being the World Head and Neck Cancer Day, to set the stage, can you help us understand what is the magnitude of the issue that we're speaking about here, as in the mortality, the morbidity, the cancer burden, especially related to tobacco use, and what are the kind of cure rates and the costs that patients usually undergo when they're diagnosed with cancer?
Thank you, Pragati. Thank you for putting up the context, and again would like to congratulate India DBT Alliance and the entire team for this effort at IPH. Today is the World Head and Neck Cancer Day, and paradoxically, I was discussing with some of my colleagues today that actually our department should not exist. This department is actually man-made, and for some strange reason, the pride that we take in doing, today I did 3 major surgeries. Is this a pride that I should take in? And when all the 3 were tobacco related, where I removed a jaw, a tongue, or a throat of a patient, I think for me is a quite a dismay to say that we are actually talking about global data in a department that need not be there, and celebrating that day also today. and saying that we are still having these head and neck cancers, while the survivors, majority of them, and 90 to 95% of this is attributed to tobacco. And what I personally see is this is one area, the head and neck area is the area that gives you identity. It is that area that gives you speech, communication. It is the area that is your representation to the society. And it is in this area that when you get a cancer, it kind of disturbs and shakes your identity of who you are. And that's when what I see in these patients is that young patients who go through cancer, who go through tongue, jaw, mouth cancers or throat cancers, thyroid cancers, are going through debilitating phases of their life in whichever age groups that kind of somewhere feels them at loss of their own identity. Whether it is their voice, whether it is their speech, whether it is the way they eat, and whether it is the taste of the food that they eat. And that, I think, is one aspect of the human dimension that I've seen with head and neck cancer. The second aspect, which is the financial aspect. Today, I often wonder that every year we see thousands of cancer patients across the world and a few lakhs in India. Almost 1/3 of the 10 lakh cancer cases that we see in India are related to head and neck, almost 1/3. Now, these are the ones that are picked up, majority of them in the late stages, and hence have to undergo multiple modality treatments. That means surgery with chemo and radiation, which itself is a very significant cost burden. And considering that the purchase power parity of an average Indian is less than $2 a day, we know data shows that state governments on an average must be spending about 1,000 crores per year on healthcare of these patients tobacco related. So it's a very significant out-of-pocket expenditure for patients, or even from an insurance point of view, a preventable one. And today, it is very, very important for us to relook into this entire, I would say, burden of cancer for these particular group of patients to, one, understand how do we reduce the cost of healthcare. Ayushman Bharat has come as a very significant supporter. But yet, I think the aspect that needs to be addressed is how do we look at addressing the unmet need of preventing these cancers? How do we reduce these cancers, and how do we reduce these departments in each oncology center? I think that is something that should be our aim and goal at this particular World Head and Neck Cancer Day from my side. And in the coming years, to hope that our activities focused are more on, one is prevention, second one is in early detection, that is the secondary prevention.
Thanks, Dr. Vishal. Also, you mentioned that cancer has been made as a notifiable disease, so in Karnataka and in a few other states. So how has this measure particularly helped in prevention or in strengthening the system to tackle?
Incidentally, a few years back, it was on the World Head and Neck Cancer Day that cancer was made a notifiable disease. And today we are here looking at the impact of it. The importance of data and collecting data to analyze this is a very important one. And that's when cancer came as a notifiable disease, because to look at the delivery system of cancer, to analyze the causative factors of cancer. I'm talking about 18 to 19 subtypes of cancer that we deal with. It is important to understand the data, understand which areas do people come from, what kind of cancers are there, why is liver cancers increasing in one particular district versus or one particular population subgroup, or versus through head and neck cancers being represented more in North Karnataka. This could also have strong implications in policy. And that's why the government has always encouraged hospital-based cancer registries and population-based cancer registries, which help in better planning, access to healthcare and treatment of patients. And in addition to that, helps government direct policies and expenditures in the right direction.
So in the long term, this is definitely going to help, wherein we'll have a reliable source of data, which can then help us in policy guidance. So
absolutely.
I think, thank you, Dr. Vishal. And although you're a head and neck surgeon, you have always moved a lot ahead in terms of prevention. So be it sensitizing different departments or ensuring that there is a good buy-in of several policies. So do you have any message for any young doctors or other active citizens who might be thinking how can they contribute to this, control of cancer?
No, I think today, Pragati, I keep thinking this, and I think these are some of the joint lessons I also attribute and thank IPH. One of the things that I learned in this journey was participatory democracy. When I want a change, I be a part of it. I work towards it. And for me as a cancer surgeon, I think one of the things that I was always inspired by was can I reduce one cancer hospital? Can I not instead of building another hospital, can I reduce an hospital? And that is where I think my initial associations from I think 2000, I would say 8, 9 onwards with IPH has been to understand various facets of public health which are equally important, to actually understand the social determinants of health, and to address the health in all policy approaches, which often gets neglected. So today, for anybody aspiring to actually move towards the aspects of what do I do to participate, I think each and everyone present here listening to this could actually participate in a small way. I think there is nothing I would say great need not be grand. The great things can be done in a very simple, small way. It can be done through counseling your family member to quit tobacco, or to kind of helping a cancer patient through a survivorship journey, as what we have with Nalini today, who inspires patients through a phone call. It's a simple inspiration, but that inspiration has resounding effects when we talk about the scale of it. So I think I would like to reiterate that great is not grand, and also to tell that participatory democracy is essential for bringing about a sustainable change, which is what we all today, I think even one decade later, I'm still connected with you. We are all talking today and still talking on topics that we believe can be impacted through this change. I acknowledge my friend Dr. Upendra Bojani here again, who's been a part of the journey, who's again been one of those people who has continued to drive this entire program in the same fervor that he started with. I think at that point, I don't see a change in the level of his energies. So these are small baby steps that we are taking, but I think eventually will lead to a monumental change. And I think we cannot underestimate the power of small efforts that we take together in order to bring this change about. And my appeal to all of my friends, colleagues here would be to say that there's nothing called small and big here. Let us try to make that one small participatory change. If you believe in this, if you believe in this cause, if you believe that you want to make a small change to cancer, I think this is the first step to start with. And I think I would like to end with this note that today somewhere in the society, we're becoming a cancerous mindset. Unlimited, more, instant. These are the kind of things that we are moving towards, which leads to heavy consumerism, leading to compromise in ethical values, leading to compromise in economic outlooks, assuming a vulture capitalistic approach that we are adopting somewhere to say that somebody else's problem is my opportunity. I think we need to move towards the aspect of conscious capital approach, wherein we kind of solve problems, but also try to look at the root problem and solve it there, not persist with the problem to make it a revenue model. Thank you. Thank you, Pragati.
Thank you. Thanks a lot, Dr. Vishal, for those inspiring words. I'm sure that through this talk and through several of your talks, you would have inspired individuals to join this journey with you. And that's how we've all continued. So thanks a lot again for making time. I will go to the next panelist and I'll come back to you a bit later. Thanks. So we also have with us Nalini Satyanarayan. And so to start our conversation, maybe I'll request Vivek to play a brief video about her so that we get to know her a bit better. And then we'll speak with ma'am. Ma'am, you're audible, ma'am. Yes, you're audible now. We'll just play a brief video and then we'll start our conversation.
Nalini was 62 years old when she started losing her voice. That's when they gave her the bad news. Vocal cord cancer, they said. Much to her surprise. Do you smoke? They asked, already convinced. No, she said. I never have. But my husband did. 18 cigarettes a day. That's almost 2 packs. Couples, they share everything. And smoking is just the worst of them. Nalini's vocal cords had to be removed. It's God's will, she said. Her eyes blurred. But try as she might, she could find no words. It has been 5 years now since Nalini has been cancer-free, helping others beat the disease.
Join the fight against second-hand smoking.
That's only her plea.
Thank you, Vivek. Nalini ma'am, I hope you're able to unmute.
My video is not coming.
Ma'am, that's okay. I think we can hear you now.
Okay.
Yeah, thanks a lot for joining us, ma'am. And we just played a brief video about you. So it was good that others could get a glimpse of you.
What should I do? Should I press the camera?
Ma'am, there is a camera icon. If you can press that, then mostly the video should come up. Otherwise, we can hear you clearly. We can go ahead.
Okay. Where is the camera?
It should be next to the mic icon only. Or else you would have got a message now.
I don't want to press anything, then if it goes.
Okay, ma'am. So it's okay. Maybe we've seen the video, so everybody has a sense of yeah, I think yes, we can see you now, ma'am. Yes. So ma'am, thank you for joining us today. And what I would like to start with is that we've seen your journey very briefly in the 1-minute video. But according to you, what has been the most difficult part post cancer to get back to a comfortable life, back in society and back to your routine? If you could share briefly on that.
Hello, Pragati. Good evening, everyone. I'm Nalini Satyanarayana, 75 years old. But age is just a number. It is your confidence and positivity that makes you live your life well. Actually, after I finished my surgery, I was a little scared that I can't talk. But thanks to the processes and thanks to Dr. Vishal, I'm back, bounced back to normal. Actually, I get to cough very often, and because of this, I can't smell properly. My smelling, this thing has gone. But now I'm able to smell strong smells like elaichi, lemon, pudina, and I'm trying to make it better day by day. But I am thanking all my doctors and the people who have encouraged me to come to this level.
Yeah.
And God has been kind enough to give me a voice, even though I lost my real voice. But I don't regret or pity myself. I go everywhere, try to give awareness programs and tell everyone not to smoke or get addicted to smoking. Actually, I was a victim of passive smoking. But actually, according to me, passive smoking is worse than direct smoking because the passive smoker inhales all the toxins, whereas in direct smoking, the smoker exhales toxins. So we should be very careful and try to stop public smoking also ban all the TSAs in the corporate offices.
Thank you, ma'am. Thank you a lot for sharing how it has. It's not been easy, but you've also not given up. You've made sure that you have remained positive in this journey, and in a way, you've inspired many others who are either tobacco users, inspired them to quit, and also people who have been diagnosed with cancer and helped them cope with the illness. So ma'am, you mentioned that you also go to several of these training sessions. So in your experience, what is it that really motivates or encourages behavior change among people, especially tobacco users? Would you like to share something in that line?
Actually, they should know the bad consequences. They suffer physically, financially, and even the family suffers because they will be getting cancer or some other disease due to the use of tobacco regularly. I try to go to schools, colleges to tell the children that they should get addicted to smoking, because once you do you try the cigarette for thrill or peer pressure, you get addicted and you can't come out of it so soon. You have to really suffer a lot after that. I am also a member of the Big Hope support group in NCC. We are all 20 survivors who meet up every month, and we call some doctor and ask him to lecture, and we ask question answers. We also go to the bedside of the patients and counsel them. Counsel the patients.
Okay. Yes. Thanks, ma'am. Thanks for sharing that. I think we often undermine the importance that such support groups and even just brief interactions with someone who has survived and who can, give back to the society. So thanks a lot for engaging in all those activities and sharing briefly about it. I'm sure the Pink Hope support group, as well as the other groups that you're part of, will be benefiting immensely from each of your contributions into it. Lastly, ma'am, do you have any suggestion or any thoughts on how government could strengthen or improve tobacco control efforts?
Actually, the petty shops around the corner, they have a lot of these laborers who smoke there, and many people who come to buy things suffer because of the passive smoking. So even when I tell that shopkeeper, he says, if I don't sell cigarettes, then no one will come to my shop. So the police and the government should make strong and strict implementation to stop this cigarette smoking around the shops, the schools, colleges, and also in restaurants and other places like airports and railway stations where people are there, because ladies and even the children get affected because of this, and they suffer a lot after that. Even though I didn't smoke a cigarette, I have suffered for the past 15 years. So I'm telling you, even without smoking, I got this cancer. But of course, I am not detected because of that. I try to do the best for the society. If I can, I would like to create a tobacco-free country in the near future. My motto is forget the past, live in the present, and hope for the future. Thank you for
Thank
listening.
you, ma'am. Yeah,
So,
thank you for the inspiring note. Yes.
If
Thank
I
you.
had got the video, I would have been very happy.
Yes, ma'am. But I'm glad that we could at least play the brief video so everyone got to see you. And towards the later part of the discussion, I think after Mr. Prabhakara completes, if we still have time, we can engage in another round of conversation. Thank you,
Thank
ma'am.
you so much, Pragati.
Yeah,
Thank
thank
you for
Thank you. So now we move on to Mr. Prabhakara. Thank you for joining us. And I think you would like to share some slides and then we'll go ahead. So are you able to share screen?
1 second.
Yeah.
Is it visible?
Yes, it's coming up. Yes.
Yeah.
If you can make it into the PowerPoint or the presentation. Yeah. Thank you.
It's visible.
Yes, it's
Okay.
perfect.
So I'm just, first of all, thanks for Pragati Hebar, Dr. Upendra Bojani, and Dr. Vishal, and Nalini ma'am, namaskara. Really inspired by your words, ma'am. There are two personalities here in the forum now, Dr. Vishal and Nalini. These are the two important personalities who are always inspiring us. Sometimes I used to get demotivated by many factors, but still looking at Dr. Vishal and Nalini, people like Nalini, again I am recharging and running fast to save many lives. So that is what I'm used to do. Thank you so much, Nalini ma'am, for joining us and guiding us. Few thoughts with regards to this particular discussion. What is the current scenario of public smoking? So, ma'am, we have around 22.8% of tobacco users in Karnataka as per the survey of 2016-17. And currently, smokers around 16.8% and urban smokers, especially 6.7% and 10.3% are rural smokers. It means, so we are finding more smokers in rural sectors than the urban areas. Overall smoking prevalence decreased from 11.9% to 8.8%. That is one of the good thing in terms of smoking in public place, but still we need to go. And close to 2 to 3 crore users in Karnataka, tobacco users in Karnataka, more than 3 crores. So my question is, the remaining 4 to 5 crore population out of 7 crores, they are the indirect users by their ignorance or by avoiding this kind of passive smoking impacts. So we are silent on these aspects. Very few people like Nalini and others are talking against the harmful of public smoking. And result, because of this silence, because of this ignorance, because of this negligence, we are getting more than 13 lakhs tobacco deaths every year. And smoking is also one of the foremost reasons for this type of deaths in this country. I'm just sharing the one slide. It says, what is the COVID deaths in India? As per the government data, it is around 5.6 lakhs deaths. 5.6 lakhs deaths total. But in India, every year, more than 13 lakhs tobacco related deaths are happening. But we are not serious on this part. Especially the non-smokers, we are not serious on this part. I think both the government, general public, institutions like IPH, we have to pitch in and we have to fight against this particular issue in a serious manner. What government has taken measures to reduce the smoking in public place? Since I'm working with the government, I have presenting some of the data here. Implementation of National Tobacco Control Program, yes, we are doing since 14-15. Expansion of NTCP program from 2 districts to 32 districts. Now we are working in 32 districts, including BBMP jurisdictions. Close to 125 dedicated staff we have to take care of tobacco control program activities to prevent the public smoking. And we have 176 court pass squads to take action against the public smoking. and close to more than 1 lakhs cases we are booking under CODPA, especially on the Section 4 violations every year. So police, health, and many other RDPR, many other departments are involving in this process. Minimum 3 to 4 district level review meetings are happening every year in all the districts. We also do a lot of IEC activities, school programs, sensitization workshops, training, and so many. But the questions remains, are we successful to control public smoking? Maybe partially. The data says 5 to 6%, something like that. But it is not at all enough. It is not at all enough. So then what is missing? Where we are failing? So some of the thoughts for, according to my experience, there is a great need for CODPA amendment. We are still working on the old 2003 CODPA amendment, CODPA law, and we are enforcing 50 rupees challan, 100 rupees ka challan, 200 rupees ka challan. It is nothing for them. So I think we need to work on this part, and it is already in pipeline. Both IPH and other many organizations are working on to insisting government to do the CODPA enforcement. Even at the state level also, we are in the process of amending the CODPA at the state level by increasing the fine and the punishment. I think this has to be happened immediately. Third, the second thing is tobacco control enforcement mechanism needs to be strengthened in city corporation areas. As Nalini Madam observed and recommended, so a lot of violations are happening in the highly densitized areas, that is city corporation areas. If you look at the BBMP, any corners, we can see the lot of point of sales where there is no compliance on the Section 4 of CODPA. So enforcement needs to be, we have to be done in a very effective way, especially in the BBMP jurisdiction. So accelerating the tobacco control efforts in the BBMP jurisdiction and the other city corporation areas is very, very important. I think we are weak in this area. I think we have to do some more work on this part. And where is the community involvement? Who is talking about tobacco control program? We are very few members are talking about the tobacco control program. Very few members are bothered about the tobacco control program. How many coalition members are active? We have many 2-3 coalitions. How many coalitions members are talking about the public smoking? How many complaints state tobacco control cell or district tobacco control cell authorities are receiving from the general public on the CODPA violations? So that is one of the questions which always bother to me. So we are looking at Dr. Vishal, we are looking at Dr. Upendra Bhojani, or some few people, if anything's happened on the tobacco control program. Why others are not bothered? Why other people are not involving? That is the big question. I think we have to get the answer for this. And 4 core passive smokers are very silent without using their fundamental rights. So most of the time I have seen in the bus stands and other places, they used to go away from the smokers without questioning the smoker, please let the smoking. They are not speaking anything. They'll just go out from that place and without questioning that particular person. Though they are standing more than 8-9 people in the public place, they are worried about to question a one smoker in the public place. That is the situation what we are having currently. And even they are not aware whom to complain, where to complain, how to complain. So they don't have any trust on the government systems as well. I think we need to work on this part, how we can increase the public involvement in the tobacco control activities. So I think we need a lot of ambassadors, we need a lot of soldiers to fight against the massive tobacco industry. And the participation of NGOs and civil societies in TC. How many NGOs are working in those parts? Very few. Do they don't have any interest on this area? And I'm telling you, ma'am, and I'm telling all the listeners in this particular webinar, we don't want any budget for this. We don't want any much budget for this. We don't want any specific job to do the tobacco control activity. A simple common sense, it helps us to take law to protect the passive smokers. I think we need to escalate. We need to bring the NGOs on board and civil societies on board, so that the government can the government burden on this particular issue is also reduced, and the effectiveness of tobacco control can be improved. And how can we involve the celebrities for tobacco control activities or create awareness among the public on the passive smoking? So Vimal, they are using Ajay Devgan, Akshay Kumar, Shah Rukh Khan. Why we are not using any celebrities? Why we are not able to advertise similar kind of Vimal advertisement in the major public places? So I think that questions we need to ask ourselves and get the answer for it. I think these are the important aspect I need to highlight in this particular webinar. So what is the solution now? The solution is, I think, tobacco-free generation vision. We have to work on the tobacco-free vision. So how many days we have to do the enforcement activities? Is it only enforcement help us to creating tobacco-free generation? No, I think we have to work on a comprehensive manner. We have to work as a unit, it is in a social. It should be in a social movement for creating a tobacco-free vision. And all the tobacco control experts, tobacco control workers, everybody, they should have a one single vision, that is tobacco-free vision with a clear roadmap. By next 2022-23, what should be our progress? How many government offices should be declared as tobacco-free? How many educational institutions should be declared as tobacco-free? How many villages should be declared as tobacco-free? We have to set the target, and we have to evaluate based on the set target, so that we can see some progress. So I think this needs to be done, and it is the responsibility of the government, NGO, civil societies, media, and many other stakeholders. Are we successful to catch the young minds of India on this issue? How many students are aware of this particular issue? Why we are not? For example, the same question I asked even Dr. Pragati day before yesterday. There are 4 crores population. They are the passive smokers. They are not the direct users of tobacco. Why they have not started tobacco? Why I have not started tobacco consumption during my college days, during my school days? Why I am still a non-smoker? Because somebody motivated me, somebody protected me, somebody educated me, and my own thoughts, my own behavior helped me to be non-smokers even till now. Not direct use. I am not a direct user. So I think somewhere we are missing to reach the children and the college students. I think we have to revisit our strategy on school program and college program. And what would be the better strategy to stop new recruitment? How we can stop the new recruiters? So right now we have around 3 crores of tobacco users in Karnataka. How can we stop the new recruitment? That is the question we need to ask. And what is the role of educational institutions? They are simply displaying the section 6B signages and TOEFL signages. Is it enough to protect their children, students? And they are behind the rank. How many ranks we have got for this college? That is the criteria for them. Their health is not a concern for them. I think we need to work with education institutions in more serious manner. And what parents are doing? Parents are happy with sending their kids to high class schools and colleges by paying lakhs together fees, but they are least bothered about their children health and what they do in the leisure time during the college days. And how far we have sensitized the political leaders to talk about this issue and to frame some good rules. That is also we need to rethink on this part. And what about the enforcement authorities? Is it enough? We are having 1 squad per taluka. Are they able to reach each and every corner of each block level or taluka level or village level? This is not at all enough. So I think these are the few thoughts I'm just putting on your heads. Please give your suggestions how best we can improve our work, improve our tobacco control program. So over to Pragati.
Yeah, thank you. Thank you, Prabhakara, for sharing what all has been done, but still a lot on what still needs to be done. So there is, as you rightly point out, a lot more that needs to be done. I would just like to place the question, like the discussion that we were having the other day on, as per GATS data, there is so much awareness. There is a very high level of awareness that tobacco is harmful, but still people use it. So how is NTCP trying to tackle it? And is it enough? From your presentation, it does show that it isn't, but specifically for this particular point of awareness and translating to practice, can you share a bit on that, your thoughts?
Yeah. So we are working on schools, we are working with colleges. Okay. So as per the TOEFI app, it says 72% of schools and colleges of Karnataka are compliant with the TOEFI guidelines. But my question is availability of tobacco products within the 100 yards of educational institutions. And the kind of BCC happening with the students. So tobacco is not available within the 100 yards of an education institution. Okay, fine, on those schools. But if they go out from the school and colleges, again they are accessible to the tobacco. So we are not working on that part. So I'm good. I'm happy that we have got a tobacco vendor licensing policy, but still we are struggling to implement, even entire India, even in Karnataka also. Okay. And the second, the point is, so we have done school program, we have reached some students in one time. What happens afterwards? What follow-up we are doing it? So these are the questions. I think we have to work on it. Yes, we are giving one round or 2 rounds of message to these schools, college, and students. But I feel this is a behavioral change communication process. In one shot or second visit or third visit, we are not able to change any person. So the family should work on it, teachers should work on it, SDMC committee should work on it, tobacco control cell people have to work on. So everybody has the responsibility to do some kind of BCC on a particular student or the group of students or group of individual youths. So this is missing.
Yes.
This is missing. That's my observation.
Mm-hmm. Thank you. Thanks for sharing. Another point you mentioned in your slides as well was about district level, like quarterly reviews and meetings. So I wanted to understand from you, being on the field and having worked in the area for several years, are there robust reporting and reviewing mechanisms? So you raised a very important point about setting targets. Without setting targets, what are we evaluating ourselves against? But currently, the review mechanisms, can you explain a bit about that? How is it functioning? Are they able to track the right issues?
Yes. So earlier we used to, so DLCC meetings are happening just for 10 minutes. I have done the small research on that part, just for 10 minutes. Now, one single DLCC meetings, at least 45 minutes. And that is also exclusive DLCC meeting. And if you see any proceeding of the districts, more than 15 to 18 points are there. Discussion points and action points for all the 7 to 8 departments. And next meeting, they used to collect the action taken report based on the proceeding. And all the action taken reports will be reviewed in the first part of the meeting. So that was happening now. Now we are insisting redesigning the DLCC meeting. Now we are asking, okay, you have done the 100 school program in this year. What is the total universe in your district? 3,000, 4,000 schools. Out of 3,000, 4,000 schools, how many schools are compliant with the TOEFI guidelines? All the indicators. How many have reached 7 indicators, 8 indicators, 6 indicators, on what percentage? How they are progressing monthly? That needs to be presented by Department of Education, not by the district cell. There is an order from the RDPR saying that minimum 20 cases booked by PDOs, each PDOs per month on tobacco Kotpa. So, and Deputy Secretary RDPR is the nodal officer for RDPR tobacco control activities. Now, the RDPR person, Deputy Secretary, should present in front of DC how many cases they have booked in that particular quarter, not by the District Tobacco Control Cell. How many cases booked by police? Home Department going to present. What awareness programs run by health? What IEC activities done by health? What TCC activities done by health? They have to present. So this kind of redesigning of meetings, DLCC meetings, we are proposing, and in some districts it is now working. And so that we can take the task to each and every person. If you see the NTCP operational guidelines, every district has got their own responsibilities on tobacco control activities. If you see the Kotpa law manual, each department has their responsibility in their jurisdiction. Unfortunately, so earlier used to Gumpinali Govinda. Somebody is presenting and some will come and they'll have tea and biscuit and go with by signature. So it is not going to happen now. So each department has to be taken serious action in the last quarter. They have to present, and in the same meeting we will set the target. Okay, this quarter we have done this many tobacco-free educational institutions. In next quarter you take 10% or 5%. So again they have to present in the upcoming meetings.
Okay.
This kind of task we are setting for each and every department.
Mm-hmm. I think that's a very good thing to hear, that finally the responsibility is also being shifted, and it's not now completely only a health department mandate to ensure that everything is done. And implementation can only move forward when all the stakeholders play their specific roles. So thank you for sharing on that. We have a couple of questions in the chat, so maybe I'll take as long as time permits, 1 or 2 questions. So one is on the vendor licensing status. You mentioned that it's come up and it's happening. So where are we in Karnataka, and is there any other state that has already implemented it well? Any tips or suggestions from other states?
Yeah, see, Jharkhand, Bihar, Lucknow, and many other jurisdictions, they are implementing tobacco vendor licensing. As far as Karnataka, yes, we have got the gazette notification, and Maya and other tobacco control people, they have given their standard operational SOP to effective implementation of tobacco vendor licensing. And recently we have done one discussion with the BBMP tobacco vendor licensing authorities and about the what should be the SOP on tobacco vendor licensing. And this 3rd August, probably, I am not sure about the date. So I had a discussion with the UDD ACS, and we requested from the state cell, we requested them to have a one round of state level brainstorming session with all the key people of tobacco control activities and licensing authorities of UDD, by involving the officials and the institutions which are already working on tobacco control outside Karnataka, like Bihar, Lucknow, and Jharkhand. So those people also we are inviting, and we are taking their feedback. We are taking their learnings on the implementation of vendor licensing. So next month we are going to have one state level workshop with the UDD, state, cell, and and all the tobacco control experts who are working on the tobacco control activities in the state, and few representations from the other states who are implementing tobacco vendor licensing. So by sitting all of us, we are going to design the standard operational procedure for implementation of tobacco vendor licensing. And as Dr. Vishal and others suggested earlier, let us go for a phased manner implementation. Let us take a small ward, so that let us try to implement vendor licensing in that particular area by sensitizing the political leaders, by sensitizing the religious leaders, by sensitizing the vendors association leaders. So let us take on board, and let us try to do this when implementation smoothly without any issues. So that's
Sure.
what we are planning, Dr. Pragati, with regards to tobacco vendor licensing implementation.
Okay, great. I think that will be a very fruitful discussion when we learn from others' experiences.
Correct.
So you can already come to know about some challenges and
Correct.
counter them and address
Correct.
them.
Correct.
There's another question related to the education department data. So for example, TOEFL guidelines and Section 6B compliance, where can we get such data? Is it accessible?
So Government of India, they are sharing the quarterly report to all the state cells.
Okay.
For example, how many schools or colleges they have 6B violations? How many schools are completely compliant with the TOEFL?
Mm-hmm.
So those things that they are sharing with us, and the state cell is sending those emails to the concerned district cell to take the legal action on sale of tobacco within the 100 years.
Okay. Okay.
Yeah.
Another final question is on the NTCP complaint app. So there was a app where people can complain. So can you share a bit about how is the usage and is any action being taken? Are people aware of it?
Yeah. So the app Stop Tobacco app we have launched way back in 16-17. But that particular app was limited to only 10 districts, and unfortunately, we are not able to give a lot of visibility to that particular app, and the hit rate is very, very minimum. So, and with that, and we have taken the feedback from the people, how we can upgrade the app, how we can make more visible to the public and accessible to the public. So we have got some feedback from the general public and the tobacco control people. Now we have upgraded the app with the geolocation. Now you no need to type your locations, all those things. So once you capture the photo, it will collect your location. So that is app is ready now, and it has TOEFL signages also. We have uploaded the TOEFL signages also, specific signages also, and we have also updated the TCC centers with the counselor's name and contact numbers. Okay. So now it is ready for relaunching, and we have upgraded from 10 districts to all 30 districts, including BBMP jurisdictions.
Mm-hmm. Okay.
Including BBMP jurisdictions. Okay. So once public register the complaint by using this particular app, so we will the complaint will go to the concerned district anti-tobacco cell email. Example, if you book a case in Bellary, the case will go to Bellary NTCP email ID.
Okay.
With the copy to state cell.
Mm-hmm. Okay.
We have an admin panel. We will receive the one copy.
Mm-hmm.
Within 6 working days, District Tobacco Control Cell Bellary has to take action on that in particular complaint. So they will send the email confirmation on action taken with the photographs.
Okay.
Once we receive the email confirmation from the district, we have the button called case open, case closed. We will click the case closed button.
Okay.
Once you click the case closed button, you will, who has complained, given the complaint, he will receive the feedback message saying that we have taken the action based on your complaint. Thanks for your support.
Okay. Okay. So the full loop is being closed.
Earlier, that particular complaint used to go to the DHO email ID. Now it is going to the NTCP email ID. So we have cut down some process to speed up the things.
Sure. Yeah. And yeah, I think one final question. I know we are just about at time, but maybe this tobacco-free generation, I think it's a very promising vision for our state.
Yeah.
So do we have any document or guidance on this already, the plan?
That's what. So we had a one state consultation in December 2020, and we have got some feedback on the roadmap of tobacco. So roadmap is very simple: tobacco vendor licensing, Code-PA amendment, increasing of legal age, upscaling of tobacco cessation services, effective implementation of TOEFL. These are whatever we have working on this strategy. The same thing. There is no change in the roadmap. media involvement, so many things. But now we are setting up some target to assess the tobacco-free generation campaign progress. So we are saying that by 2025, we are reducing the tobacco access to the minors.
Okay.
Correct? In that line, how far we progressed? For example, TOFI compliance. This year, we are having some 60% compliance in the state. So what should be the next year target? 70% or 72%, whatever. Okay? So against that target, how far we achieved? If not, why? That we have to do. So some kind of this particular exercise we are doing it.
Okay.
And we will also share these documents to you once we finalize, because there should be some scientific evidence to set the target.
Correct.
So I cannot set some biased target individually. So I will share those documents to you. And right now we are developing some IEC materials on tobacco-free generation. And now it is going to be the government program. It is not the union agenda or the IPH agenda or some NGOs agenda. It is the government agenda. So surely I'm completely confident that our government will take it up this agenda. So shortly they are going to announce this particular tobacco-free generation policy as a government one of the agenda for the tobacco control.
Sure. Yeah. Thank you. Thank you so much for sharing about all the work that's going on, the future plans. We are just on time, so I'd like to thank all our panelists of the day, Dr. Vishal Rao, Mrs. Nalini Satyanarayan, and Mr. Prabhakar Pujari, for candidly sharing their thoughts and suggestions. And the recording of this will be circulated, and we look forward to any feedback or suggestions. And if you'd like to know anything more about the Anusthana project, feel free to visit our website. And thank you everyone for your time and for participating today.